We have with us on the line this morning Jaron Collymore, the manager of the Tobacco Control Unit, and Dr. Mark West. He is the Special Medical Officer at the Lung Cancer and Thoracic Malignancy Unit at the NCRHA. And as we were saying, over the years, we have seen the evolution of tobacco culture. In the 80s and 90s, it wasn't rare to see tobacco being advertised, whether in television, whether in print media. It was in films as well. And of course, over the years, we've definitely seen that change. So let's talk to these gentlemen this morning about the change to packaging. Good morning and welcome to the show, Dr. West and Mr. Collymore.
Good morning.
Hi, morning.
Hi, good morning. Thank you so much for joining us on this early morning on the Now Morning Show. Definitely an important conversation that we need to have, of course. And one of the main things we need to know is, what are these new health requirements?
Hi, morning again to the panel and also to the public. Well, the government healthcare warnings requirements requires it's actually begin at next week, Monday, the 26th September. It requires all tobacco products to actually have graphic healthcare messages on them, meaning like cigarettes, cigar boxes, cartons. Healthcare messages are used to actually identify like the major healthcare issues that that tobacco contribute to. So they actually have like graphic in nature dangers of tobacco, such as like cancer of the mouth, the neck, the lungs, gangrene, blindness, the cause, impotency in men, and also stillbirths in women. So the main aim is to actually deter persons from actually smoking and actually encourage those who don't smoke, and those who actually smoke to get necessary support, help.
Mr. Collymore, has it been proven that this labeling approach actually does deter people from smoking? Have we seen a decrease in smoking statistics over the years?
Yes, correct. In countries which actually implement the healthcare warnings, such as Singapore, Canada, and Uruguay, we saw that, okay, that it's actually a demand reduction technique, where that the demand for cigarettes actually decreased, as actually recommended by the WHO Framework Convention, as a way to actually decrease the demand of smoking, like where you have, for example, tobacco taxes, regulations requiring no advertising of tobacco products in the media. It's a way to actually discourage the public, especially youths, and from smoking. So it's actually proven scientifically as a way, because before you had a text message, the text healthcare warnings, where it says the Minister of Health says tobacco is dangerous to your health, and pictures create a greater impact along with text to deter persons from actually smoking. Studies has proven that.
Oh, okay. Dr. West, good morning and welcome again to the Now Morning Show. Thank you so much for joining us. Now, one of the things that Mr. Collymore did mention is some of the hazardous effects that we know, of course, through education, we are now seeing on the packaging. And a question to you, of course, working here in Trinidad and Tobago, how prevalent would you say these effects are on our population?
Good morning, and thank you for having me, and thank you for the panel. Tobacco consumption is at the center of all the main non-communicable diseases that we find throughout the world and in Trinidad and Tobago. The Pan American Health Organization has classified these NCDs into 4 main categories: cardiovascular disease, cancers, pulmonary disease, and diabetes. Right at the center of all of these is tobacco consumption and smoking. And it has been shown that, as Mr. Collymore says, the reduction in tobacco consumption directly leads to a reduction in these types of NCDs. So we here in Trinidad are getting on board with the rest of the world in improving our marketing and labeling of the dangers of tobacco consumption. It is a fundamental issue, it's a fundamental health issue, and it is one of the most direct ways we can improve the health of the country.
Yeah, definitely agreed. Dr. West, do you have any, or can you share with us rather, what exactly happens to somebody's body when they quit? Because many times we ask people to quit, we share with them, you know, it's time to quit, but we don't share with them the changes that your body goes through once you start to quit. So could you share that with us this morning?
Sure. There are 3 principal effects that happen when you start to quit. First of all, smoking is an addiction. So it has both a physical and a psychological component. The psychological component is far greater than the physical component and is often the most difficult one to accept or cope with. But cigarette smoking is based on nicotine consumption, and nicotine gives what is called a so-called high when it's first started. This is due to the release of serotonin and dopamine receptors in the brain. And it takes a while for these serotonin and dopamine receptors to reset once you stop. So there are things which can help in the cessation of cigarette smoking to address the physical addiction by allowing for a supplement of nicotine and the dopamine and the serotonin receptors. The psychological component, though, is more of a habitual one. And as those smokers will tell you, they do certain activities, they need a cigarette, or after certain activities, they need a cigarette. And it doesn't really matter what the physical component is. For that, you need a psychological approach, for which there should be and is counseling. So these are the two main effects. And the third effect, of course, is for people who smoke heavily, they will have noticed the nicotine staining in their fingers, their clothes, their face, their teeth. So once you stop smoking, your breath improves, your whole hygiene improves, and also your physical well-being, cardiovascular physical improves, because nicotine causes the blood vessels throughout the body, particularly those of the heart and brain, to get narrower or constrict. So there's less oxygen going to your brain and heart when you're smoking. You're less fit. So by stopping smoking, you drastically can improve these.
Oh, good to hear. Mr. Collymore, as we talk, of course, about the new packaging in particular, are there going to be any fines involved for those who may not follow these new rules once they come into effect?
Regarding the implementation of the healthcare warnings, next week, Monday, now all of the tobacco license holders are aware of it, and also the TCO, the Ministry of Health, has been doing sensitization sessions with the business associations, like Chamber of Commerce, Market Association, the MP Quick Shops. Now, if, for example, your product doesn't actually have the healthcare warnings, there's a risk, first of all, of your product being seized by the Tobago Police Service or the customs officers who are authorized to actually seize it under the Tobacco Control Act. And later on, there may be charges and penalties attached based on the regulations and the offenses in the Tobacco Control Act. So we want to encourage all retail outlets, all wholesalers, to please ensure that all tobacco products have the healthcare warnings pre-approved by the Tobacco Control Unit and Ministry of Health on them.
Okay. Thank you so much for that, Mr. Collymore. And this both is for Dr. West and for Mr. Collymore as well. One of the things we've seen a rise in, of course, in Trinidad and Tobago is vaping in particular. So the first thing is, given that vaping, of course, contains nicotine, will these rules apply to the vaping packaging? And Dr. West, if you could share with us whether or not the same effects come from vaping as it does from a cigarette. So, Mr. Collymore?
All right. Regarding the vaping, currently the Ministry of Health is working towards regulating vaping, which actually doesn't contain tobacco, but more nicotine. Where that we understand that nicotine, as Dr. West was saying, is highly addictive, sometimes more addictive than heroin. And we want to discourage the public from vaping, especially mostly countries which actually regulate vaping, over 81 countries, have implemented regulations where the youths cannot vape, because we realize that the tobacco industry and the vaping industry target the youths, where those vaping products actually have different nice tastes and scents, like mango, spices, different flavors. So you want to ensure that please do not vape is not a recommended cessation tool by the WHO to actually stop smoking, because studies have shown that most persons who vape also smoke. So it's dual use. So it doesn't make sense vaping as a way to quit smoking.
Thank you so much, Mr. Collymore. Dr. West, could you share with us briefly whether or not vaping has the same effects as a cigarette?
No, vaping does not have the full negative effects of cigarette smoking. Cigarette smoking and tobacco consumption use over 600 chemicals. Nicotine is only one of them. Many of the other ones, such as benzene, which is produced, and ammonia, can be carcinogenic. And these are some of the reasons why tobacco consumption is related to, is related to these cancers that Mr. Collymore referred to. However, the vaping industry is quite unregulated, and the amount of nicotine you get in a vape is variable, and it requires a lot more regulation. So vaping is somewhat of a dangerous entity, and vaping has a very deleterious effect on your lungs. There are a whole range of new diseases that we are seeing because of vaping, things like something called popcorn lung, where the lung inside actually resembles popcorn. So little pieces of it are blown up and other pieces of it are removed. Then there are also another host of other types of diseases related to vaping. So my message regarding vaping and tobacco is that the only thing you should be putting in your lungs is fresh air. That's the way we were designed. And when we start inhaling all these things, we are doing harm to ourselves. I would strongly advise not to vape.
Thank you so much, Dr. West. And thank you so much, Dr. Collymore, for joining us this morning on the Now Morning Show. Looking forward to conversing with you again soon as we continue to eradicate the tobacco culture.
Thank you very much.
Okay, thanks.
Pleasure being here.
New packaging for tobacco in Trinidad and Tobago, and a lot more coming up on today's edition of the Now Morning Show. Don't go anywhere. We'll be right back.